Three. Okay.
Hello, my name is Coretta, and I'm joined by Sophia Lee, and this is our synthesis project discussion. My cultural focus for my synthesis project is adolescence. So I plan to explore psychiatric treatment modalities, barriers to healthcare access, socio-cultural influences on health and well-being, and nursing care considerations in the adolescent culture.
That's a good
What
topic,
about you, Sophia
Rera.
Lee?
Yeah, you got a good topic, huh? Um,
Yeah.
Mine you will be focused on like Somalia community and cultures. So my statement for the this project would be the cultural factors significantly impacts on patient with kidney failures in Somalia's community, including like everything from dietary habits to the access to healthcare and to the social support structure.
That's awesome. That's an awesome topic and
Thank
an
you.
awesome culture to explore. The methodology for my synthesis project is I plan to gain knowledge through qualitative research studies,
Mhm.
individual reports or case studies and discussion, and the interactive practicum opportunities that I have had for this course.
Yeah, the same way I learned this from like my observations through the health comments, especially with the women yoga that we have a lot of women from Somalia's community and do research and like on internet and also like the re-interaction with the Somalia's patient who got kidney failure, also with their family members.
Yeah. The cultural informants and gatekeepers for this population is collective society. I find, of course, it's a lot of parental input. Sometimes grandparents are within the home. It depends on what culture we're providing the service to. So you have all of that information to incorporate into the treatment care. A lot of times it could be therapists, could be school counselors, or folks that are working with educational plans
Mhm.
to provide accommodations for mental health needs. Some cultures, of course, also have traditional medicine that they utilize in combination to modern medicine, combined therapy. And we
Mhm.
also want to acknowledge that and respect that because that's an important process uh, for them to have for their healing and health and wellness management.
That's a good one. And do you also include like religions? Like I know like we live in living in the diversity community. Are you also like including religions in the your projects as well?
Yeah, because like I said, we we always want to, for this culture of folks, adolescents,
Mm-hmm.
kinships, their socializations is huge. And so we want to make sure we're getting input and we're
Mm-hmm.
acknowledging and respecting who they consider as family or kin or important folks in their lives. Because when we have those relational components, it builds rapport and
Mm-hmm.
it helps us establish the basis for that holistic care because it honors who they are as a person,
Right.
their healthcare needs, and how they interact
Mm-hmm.
with themselves and with others, whether it be friends, family, or within the community setting.
That's awesome. That's awesome. And yes, the same thing. And for my project, I would also include like language barriers and like education in healthcare. I think I have a night talk yesterday with one of my family, like my patient family member who like kind of like could not access to like a proper education, I believe, because When we talk about the kidney failure, he basically focus on the people who smoke or alcohols, but he didn't realize that like the main reason that caused their kidney failure would be like high blood pressure that we cannot control. And on top of his father who get kidney failure, his mother also have hypertensive that her normal blood pressure is around 160. That is high. And then
Mhm.
he mentioned that she didn't take any medication. And then like I
Wow.
take a chance, yeah, I take a chance, take up like the chance to give him some information, like education on high blood pressure, and that can be the cause of kidney failure as well. Yeah.
And you make a good point, Sophia, because that's very important to acknowledge language barriers with
Hmm.
certain interactions. And then that some folks don't have that educational piece on some of the symptoms that may be um, observed with different forms of mental health issues. And to
Hmm.
know that sometimes isolation and depression can be caused uh, by some of these structural causes as well in the environment. Some folks have a lot of discrimination,
Right.
institutionalized racism with medical care they've had, as you said before, uh, uh, terrible past experiences. So developing trust and establishing and building on that rapport so they have or environment that provides cultural safety to be
Right.
themselves, who
Hmm.
they are, regardless of their color, their age,
Yeah.
or whatever diagnosis they have is their lived experience. So to be able to interact in that relational way and provide that connection so that they feel safe to express themselves and just safe to be who they are and to know
Right.
that they're going to be cared for.
And I think it is very important to start from the family base that the parents can um kind of educate and show them the ways, the reality, like between their culture and also respecting to the other people culture as well. That's really important. Yeah.
It's very important.
Mm.
I agree.
Yeah.
Um, Looking at the cultural and social structure dimensions with this cultural of adolescence, technology factors is prominent for, they share a lot of phones, video games, social media outlet. Again, kinship and social factors are huge with how they're relating in their family, how they're
Hmm.
relating with friends, because at this stage in life, they're developing more autonomy, wanting to seek employment opportunities, educational, academic goals. And so developing and establishing a connection on how we support that. We're keeping them adequately managed with medications, with supports that's going to be beneficial for their mental health, and also allow them the freedom to enjoy life and not feel fine with a lot of appointments and all of this. And that may be minimizing oral medication. It may be introducing long-acting injections where they can have monthly, so it's less
Hmm.
frequent visits, so it gives them more freedom. We even have every 3 months, even longer. So it's offering all of those types of things, or keeping the meds to the minimum to maintain uh, stability uh, of health and well-being. We don't want them to be over medicated so they feel out of sorts when they're with friends or when they're socializing or when they're interacting at work or in the community. Also, economic factors. A lot of folks are in the care of their parents, so they're struggling and trying to figure out how they're going to make it on their own, how they're going to balance with the economy. So it's all of those things that additionally impact health and well-being and your mental health. And it's not everything is not diagnosis related. Some things are just part of being human. Everyone has stressors when you
Right.
have a lack of resources.
Yeah. And I believe like adolescent, they trying to figure out who they are and try to be independent by themselves. So yes, that should be a lot of support from the family and the communities and the healthcare providers. That's really um helpful. And just to align with my culture, like my project, I just would like to add like have all those like available education in the other language as well, like Somalia. So for those who didn't speak English, they can also understand like from the healthcare perspective and how to use all those medication. Yeah.
Yeah, exactly. I agree. And then connecting them to resources. I mean, some
Mm-hmm.
folks that come over here that migrate and whether they're refugee status
Mm-hmm.
or considered have an established citizenship, whatever, connecting them to resources that help them be connected to something that's more familiar, especially since they're in for a cultural shock because they've been displaced from their
Mm-hmm.
natural place of origin. So it's all of those things to consider as far as hardship and addressing care needs. Key insights about care expressions from this culture of adolescence is just, again, how they socially interact with one another, with family, with friends. Some forms of expressions I've noticed maybe a fist bump, maybe a hug, or specific handshake, verbiage or
Right.
language slang. Um, you know, uh, uh, when you're doing these mental health check-ins, it's important to ask, this is your name. Do you have a nickname? What do you prefer to be called?
Mm-hmm.
Figuring out what their schedule is and you know, what's a good time to have appointments because all of that fosters compliance. Again, what's your schedule as far as school, as far as work, working around all of those factors so they feel more comfortable. And that provides cultural mutuality. It
Mm-hmm.
provides cultural knowledge and cultural skill, and it helps with that encounter, the cultural encounter, because we are aware of what's going on, so we can address uh, the care around all of those individual needs. And so, in other words, that process of permeation and how we get through to individuals we serve is a matter of being open and being aware and listening to what best meets their health as based on how they defined it.
Right. And just to like to add a little bit, probably like you mentioned earlier, like the kind of background of the family, probably they just moved here through immigration. Some come through the camp, like refugee camp. I believe they got a lot of like traumatized through those difficult times. So like to learn about their background, what they went through, that's really is important. Like to advocate and acknowledge, like before we providing specific care. So um I mean, like we can provide the best care for them when we understand all those background, you know. Like some
Yeah.
kids, some adolescent probably come from like a family who get addicted to drug, and some family got like abusive. So it's really affect on adolescent, especially on their
Yes, it is.
psychology, yeah, their mental health, yeah, yeah.
Yeah, I agree. And so that's what I mean about understanding the intersectionalities and the complexities
Hmm.
of a condition. And
Yeah,
it's just like one single thing that caused the condition. It's a complex uh, uh, situations that attributes to daily
right.
functioning. you know
Hmm.
and so it's understanding how all of that works. And so as you begin to work with folks, you become more familiar with what's going on with them, and so it allows you to develop a deeper level understanding, so that you're able to focus care around that to provide it in a holistic manner, that in a way that nurtures empowerment and hope. um, uh, Before we get to nursing considerations, I wanted to bring up a concept that it was part of the literature on conceptual framing. With literature, she proposed using anthropology to understand the relational components between culture and care. And Purnell's model had that variety of cultural influences saying that the construct of culture is a complex whole in which we've just discussed. It's
Yes, yes.
multiple things that
Hmm.
contribute to how folks identify as a culture of folks, and then to know that it's subcultures within that, depending on what part of town you live in, what group you're affiliated with. All of those things are ways in which we identify. So adolescence in itself is a culture, um, in addition to whatever ethnicity, or tradition, or socioeconomic status, gender. All of those things are cultural components to be considered. Nursing is a culture, so we bring nursing to the table. We bring who we are as individuals. So that's why it's important for us to have uh, uh, awareness of our biases and what we bring as well, because all of that affects the dynamics of the relationship.
Yes, that's a good point. And also, like, just to add, we also like should bring all the religious in the healthcare as well. Like for my Somalia's community, we should give them time for their pray. I believe like they did a lot of pray during the days. So like to address all those issues so that healthcare provider can encourage to develop and cultural sensitive education and integrate those into community outreach and involve other community member and elderlies um, in designing like education care like for adolescent or from like drug disadvantage of drug use or the kidney care program that respect all those religions and language and traditionals in the care.
Mhm.
Yeah.
Good point. Good point, Sophie. And the next portion is nursing consideration. And when I was reflecting on the nursing consideration, I thought about uh, Sofina Bakoti's mention of cultural compatibility. And that was the fusion of cultural competence and humility. And I thought that is right on, because when you have these cultural encounters with folks, to move through that process, you have to have humility for their condition. And that
Mhm.
means that's inclusive of their surroundings, who they interact with, as well as who they identify as a person. And so it's not just being competent in skill, but you want to be competent in listening
Yeah, yeah.
and having that human to human connection, and knowing that this is their lived experience and you're just on a journey with them. So how we think cognitively, of course, affects all of those things. So, and that allows for cultural safety to occur so that folks can open up and eliminate that feeling of being seen and not heard, which is so prominent in this population of adolescents, because they have a lot of complexities with the social determinants of health. A lot of folks experience institutionalized racism, on institutionalized discrimination based on culture, because they're perceived as to have this, these certain adjectives attached to this group of folks. And so we have to be aware of all that and get to know folks for who they are, despite how they present, if they have tattoos, if they're dressed a
Mhm.
certain way, and all that. So we have to be aware of our biases, so that we can establish that rapport and connection to allow for that cultural safety to occur in the environment which we are providing care. So we're in a state of, as nurses, to advocate for health and well-being for this culture, to reduce suicidal, homicidal ideation, self-harm, which is very prominent. CD use is very hard when folks have initial mental health diagnosis to comprehend all that means as far as medication management and care. And it can induce a lot of family strain. So having that family psychoeducation, peer specialists, a therapist on site, especially with nursing and psychiatry, all of that multidisciplinary team is a part of that collective society to manage.
Right, right. Totally agree with your idea, Carreras. And I believe like as a professional nurse, on top of those, we should like give enough time for our patient to express um what they went through, and like being, I mean, being as a good listener, like yes, that giving enough time so that they can like share everything, even like their past experience, their religion, their cultures, and what is the symptom of issue that they have. That's really important to collect all those data. Yes. And yeah, Corina, I think we conclude our um, presentation. Or you have any something else to add?
I don't have anything else to add. I think we both chose some awesome topics, and I'm excited to read what you have to say
Yeah,
about your culture of choice.
yeah,
Um, it was nice to join in with you, and to everyone that's listening, we thank you.
yeah. Thank you so much.